Thank you, Chair Carter, and I thank the Secretary for being here with us today. Secretary Kennedy, I'm going to gauge my line of questioning on some of the things you're just asked. And as you indicated, you're aware of the opioid epidemic and that it's still a pressing issue in many parts of the country, including in my district. As a physician, 90% of acute pain patients receive opioids to manage their pain, whether they need them or not. Between 2011 and 2019, opioid prescriptions decreased by 40% from approximately 250 million to 150 million prescriptions dispensed, and this is true across most payer audiences, Medicaid, private, cash patients. However, among Medicare patients, opioid prescribing actually increased. Furthermore, Medicare's share of opioid prescribing during this time increased substantially from approximately 20% of the country's opioid prescriptions in 2011 to 35% in 2019, and that represents a 75% increase in just under a decade. I have a bill, the Alternatives to Pain Act, that would increase Medicare beneficiaries' access to non-opioid alternatives to pain management medications by limiting patient cost sharing, prohibiting the use of utilization management, and encouraging a dialogue between patients and their providers. I was also the director of the Department of Public Health in Iowa, which handles substance use disorder and behavioral health disorders. And I think, given your personal experience with this, there was something that you were trying to say, and if you would, I would like to give you an opportunity to complete your thoughts on the previous question.
Thank you, Congresswoman. This has been a priority for me. I've been 42 years in recovery. I lost a brother to this disease. I lost a niece during the pandemic. We've all lost friends. We've all lost family. This is a national tragedy. We should be talking about solutions to it, and we should be working together. There's no such thing as Republican children or Democratic children. All our kids are affected by this. We should be able to talk with each other about this without vitriol, without the vilification, and try to figure out the best ways for treating our kids. The Trump administration, the federal government has not done a good job at this. The Trump administration's policy is to return that money in block grants to the states and let them figure it out. As I said before, addiction in West Virginia or in Iowa is very different than in San Francisco. The solutions are different. And we need to turn those states into laboratories of innovation. They can figure out how to treat their population the most humane. Some of the best treatment centers I've ever been to are in rural Tennessee with no federal funding, no state funding, and getting extraordinary reductions on recidivism. We want to unleash that spirit of innovation in the states to make sure that we're doing the best we can for our kids. And in answer to your first question, there's a very, very exciting new drug out there called Journavex, which is a non-opioid, very effective non-opioid pain reliever. And we are doing everything we can across our department to promote access to that solution.
And would you be supportive of something like my bill, Alternatives to Pain Act, and commit to working with me in providing technical assistance?
Absolutely. Thank you, Congresswoman.
Thank you. Also, you've heard concerns about members on HHS restructuring, and having restructured a department, it's never an easy task. We also know that sometimes money goes to people within the bureaucracy rather than to the actual delivery of care, as you've indicated. And there's been changes in NIH funding and HHS funding. And my district, which encompasses Southeast Iowa, is very rural. And I was just wondering if you can explain how HHS will be investing in rural America, and specifically rural Iowa, to ensure that Americans still have access to vital healthcare services.
We have a number of programs for doing that, for expanding healthcare in rural areas. One of those that I'm most excited about is are these innovations in telemedicine and in AI nursing. That is going to deal with some of the treatment, the diagnosis issues. I've seen these systems in action, and they're extraordinary. And that AI can now diagnose disease as good as any doctor. Not as good as let's say the average doctor.
Thank you for clarifying. My time's expired. Thank you very much,
All right,
Secretary. I yield back.